welcome to episode 4 of the Groovy Beet podcast. I'm your host, Jamie Nicole, certified holistic health and empowerment coach, also known as the natural healing coach. And so as a health coach, I teach busy professionals and purpose-driven leaders. And by that, I mean anyone from corporate executive all the way to the other end of the spectrum where you have a stay-at-home mom who's president of the PTA, Girl Scout leader on our church treasury board. I help everyone in between make healthier life choices or healthier choices, dietary and lifestyle changes. As a result, they're able to increase their energy, reduce their stress, and improve their overall health and well-being. So on today's Groovy Beet playlist, we're talking about the third essential of the 7 essentials of optimal health that I laid out in episode 2. Today we're talking about safe movement. But with today's topic, we're talking about the benefits of holistic chiropractic care. On today's episode, I have with me Dr. Brittany Hill of Hill Hills Chiropractic and Rehabilitation. How are you doing, Dr. Hill?
Hey, Jamie. How are you? Thanks for having me.
No problem. Thank you. I'm so glad you are here with us today. We have the natural healing coach, along with Dr. Hill of Hill Hills. We're going to be talking about healing holistically today. So, Dr. Hill, just to get us started, can you tell us a little bit about yourself and how you got started in chiropractic care?
Well, my name is Dr. Brittany Hill. As you mentioned, I am the owner of Houston's only 24-hour chiropractic clinic, Hill Hills Chiropractic and Rehabilitation. We have 2 locations here in Houston, one right behind Lakewood Church off of 59, and the second one is in the Pearland Town Center Mall. I actually started off thinking that I was going to go into cosmetic dentistry because I grew up with really pretty teeth and I really enjoyed the dentist, and I pursued dentistry as soon as I graduated undergrad, but I had a life-changing event happen where I was introduced to chiropractic and fell in love with the holistic model of it, no drugs and no surgery, and since then it's become my passion.
Awesome.
Yeah.
So I got stuck on the pretty teeth, right?
Yeah, the pretty teeth thing, man. I thought I was going to do cosmetic dentistry, but God had a different plan for my life, and it's so good when you find your purpose in life because you're able to work with purpose, and it's a different type of work. It doesn't feel like work.
It doesn't feel like work. You enjoy talking about it.
I do.
And I've known you for a while, and you do enjoy chiropractic care.
I do. So I'm glad to be here. I'm all the way from Montgomery, Alabama originally. So Roll Tide for anybody out there, the Crimson Tide fans. But came here to Houston about 3 years ago after graduating chiropractic school. Took me about 12 years to finish up everything because I do have a master's as well. So that's why I'm able to specialize in sports chiropractic.
Awesome.
Yeah.
So at the beginning of the show, like I said, I'm a holistic health coach. And the title of the episode today is about holistic chiropractic care. And so this has been a hot topic around for a long time, or at least the last couple of years, about people trying to move more into a holistic lifestyle. It's been garnering a lot of interest. People are tired of the unwelcome side effects of medications. They're trying to eat clean. They're trying to eat organic. But we want them to focus on what they're putting into their body as far as their medicines are concerned too, right?
Right.
There's ways that you can prevent having to take those medications that cause all of those side effects.
Right.
And so since chiropractic is one of the most popular of the holistic treatments,
right,
I wanted to have you on for this 4th episode. But as we were talking about before the show, even though it's so popular, a lot of people aren't familiar with what chiropractic care is. So can you just kind of give people who may not be aware a little summary of what chiropractic care is?
Of course. I was definitely unaware of it before I got into it, and that's why I say it was kind of like a life-changing thing for me. But chiropractic is all about the nervous system. And basically, as chiropractors, we're trained to diagnose, find, and treat misalignments in joints. Now, most chiropractors are just going to be about the spine, but as a sports chiropractor, I look at all types of joints. So ankles, wrists, elbows, even sinuses. So we look at those joints and make sure there's no nerve interference. So chiropractic is built on the science that the brain and the nervous system controls everything.
Controls everything in your body.
It's one of the first things that actually form in the womb. So without the formation of your brain and spinal cord, you wouldn't be viable, basically. So as chiropractors, we know it's very important that that brain-body communication is there.
Yes.
And the way it communicates is through nerves that are come off of your spinal cord. So that's every function of your body, from your mental health to your hormone secretion if you're a diabetic, to your muscle contraction if you are a sports person, to neurological things such as MS or autoimmune things.
I'm so glad that you mentioned that, because
Awesome.
a lot of people don't know. We just think of chiropractic, I'm going to get a back adjustment,
Right.
The neck crackers, right?
Yes.
But you mentioned a couple of other things too that I think are vitally important to our listeners for them to understand of how chiropractic can be integrated into their life. Now, you mentioned at first sinuses.
Yes.
You mentioned anxiety.
Yes.
Right? You also mentioned hormones.
Yes.
And you also mentioned autoimmune.
Right.
Can you touch on those a little bit more, especially the autoimmune and the hormones? Through my first episode, I kind of let the audience know that I do have an autoimmune disease called Hashimoto's.
Right.
A lot of that impacts your hormones. So can you tell the audience a little bit more about that as well?
Well, basically, every function of your body is controlled by the nervous system. So, I mean, it's just 1 + 1 = 2.
Yeah.
It's like if the nervous system is not able to communicate with the rest of the body, then that's going to lead to some type of disease or dysfunction. So, autoimmune is something that we're still trying to get research on as to why does the body attack itself. But I truly believe it's a lot of people walking around on medication that's really unnecessary because we haven't attacked the root cause.
Exactly.
And root cause is what I practice in my clinic every day to my patients. We try to find a root cause so that we can actually heal you, HEALU.
Yes.
So that's what we try to do. And autoimmune is something that they're still working with, and I'm able to help a couple people with certain types of autoimmune diseases. And then I also do supplementation as well. So I know a lot of people that have autoimmune diseases are on a lot of medication. And an alternative to that, because we talked about the side effects that you get from medication, an alternative to that would be supplementation. They sound alike, but they're not the same. So if you're wondering what supplementation is, it's everything that you need that you're not getting from your diet. Okay, so a lot of us aren't walking around eating the things that we need to eat. Well, we have supplements that you can take to supplement what you're not getting through your diet.
And I'm so glad that you mentioned root cause. I'm not sure if many people got the connection. And when I was creating the show, I always focus on the root cause.
Root cause.
Because a lot of times we go around and we're trying to put a Band-Aid on things, and we're just covering up the symptoms, and we're never addressing the root cause. And it's also just a little insider information. The reason why I chose the name Groovy Beet and used the beet, because the beet is a root.
Right. Right.
And so it was a part of me bringing the connection with the holistic healthcare. I'm also a fitness instructor, so bringing them both of those things together.
Right.
So
Total body.
It is about getting to the root cause, and a lot of people just don't do that. They don't have time for that anymore.
Right. They don't have time, and I think the other thing is just people aren't educated. They just go into the medical doctor with their concern, and because they said so, it is so. And I'm here to tell you that's not always necessary. So my goal is to educate the community to come conservative first. So we run out to the emergency room to get the painkillers or whatever, but try conservative first, because it is a lot of side effects to that. And we tried to stand out at Heels with providing 24-hour care so that you can't say, well, it's after 6 and I had to do something. Well, it's after 6 and we're open. So call.
Awesome. And one thing I wanted to also point out, you're making a lot of good points about the doctors.
Yeah.
You make the assumption, because it is a doctor, that they know everything, right? And so whatever the doctor says is golden, but you know your body better.
Right.
And then not all doctors are trained to treat patients in a holistic manner. And that's one thing that when I was doing my research, that chiropractors do differently. They look at the entire body. They make sure that if your body's in alignment, everything's functioning properly, then your body can heal itself.
Right. And that's what we believe. The body is self-healing. How does your body know to make a scab when you cut yourself? The body is self-healing. And it's not that all of them don't know. It's just that they don't care to tell you. It takes a lot more time.
I was being nice. It
takes a lot more time to explain. It takes a lot more time to do that. It's really quick just to write a prescription and get you on your way, and you're able to function. So, yeah, we try to take time with everybody and educate them on their specific body.
And that's also part of what I do as a health coach.
Yes.
It's providing patients with that information to take to the doctor.
Right.
So they know what questions to ask. They know the letters to give them.
Yes.
They know what ranges they're supposed to be in. Doctors used to hate to see me come in. I would come with a full binder.
You need it.
Like, you need I'm not knocking doctors. You need doctors.
Yes.
But you also have to be educated because they only have that short period of time. They have restrictions per your insurance.
Right.
But there's other things you can be doing in addition to what they're giving you.
Right.
That will help you heal yourself a lot faster.
Absolutely.
And no one knows you better than you.
Absolutely.
So at this point, we're going to take a short break for a word from our sponsor.
This portion of the show is sponsored by Eye Care. Eye Care Autism Treatment Center specializes in providing center-based ABA therapy services for children with autism and intellectual disabilities ages 2 and up. With experienced professional staff, Eye Care Autism Treatment Center will work with your child in an individualized manner to bring out their full potential. We offer programs including behavior management, skills acquisition, and social skills to assist in age-appropriate development. Eye Care is currently accepting new patients. For more information about Eye Care, go to www.eyecareabatherapy.com or contact them at area code 281-781-8703.
And we are back. We hope that you were able to get some good information from the first part of the podcast. And we're going to continue the conversation, right, Dr. Hill?
Awesome. I'm excited. What you got for me?
But at this point, if you're listening online or on a podcast network, we're going to continue on. If you're watching us online on Facebook Watch, you can continue the conversation or continue listening to the conversation on any of the links that are listed in the comments. So we're on iTunes, Spotify, Stitcher, Google Play, and the full video of this episode will be in YouTube. So we're going to leave you right now, but make sure that you follow up, subscribe, and watch or listen to the rest of this podcast where we have some awesome information coming for the second half. So Dr. Hill, to continue the conversation.
Okay.
So we talked about what chiropractic is. We talked about a little bit of what they can get from chiropractic, from the basics that people normally know, just back cracking or what they call it, or adjustments.
Right.
But if I'm brand new, right, to chiropractic, I'm going to have some questions.
Of course.
Like, I've been going for a long time, but there are people out there that haven't been to the chiropractor at all, or only know what they think they know, or have heard from other sources.
Right.
So I'm a new patient. I'm coming in. How long is it before I see the difference from having a visit with you?
Well, we take everybody as an individual because you are an individual, and two people with right shoulder pain will have two different outcomes, or the way that they heard it may be different. So it's all about the assessment. It's so good that you, as a natural healing coach, are able to instruct people on what they need to bring in to the doctor. Because we're like inspectors, where we have to kind of gather all this information, figure out what's going on, and that's what we call diagnosing. Okay, so once you have the diagnosis, you're about 90% to healing. But now it's about, how do you want to go about it? Do you want to go the conservative route, or do you want to do the quick route, or the Band-Aid route?
The Band-Aid route.
So, yeah, coming in, I would say as a new patient, you want to definitely scout out your doctor, whether it's a chiropractor, a podiatrist, a dentist, whatever. As chiropractors, it's really diverse. So we all specialize in different things. So depending on what you're coming in for, I would consider what type of chiropractor would best suit your needs.
Okay. So who does it help? Like we were talking before the show started, a lot of times you may see commercials, or you might hear or know of someone who got into a car accident, and the insurance company will send them to a chiropractor. Or you see, chiropractors only treating sports or people who play sports. Right. But there's so much more that chiropractors do, and we can also use chiropractors if we don't have anything wrong. We don't have to wait until something gets wrong. Can you tell us a little bit bit more about what you treat,
Right.
and what can we do to be more proactive about our health using the holistic benefits of chiropractic care?
So I would say that you should start seeing a chiropractor as soon as you're born. If you have a nervous system, then you need to maintain that nervous system. And that's what we said chiropractors specialize in, the nervous system, just making sure that the brain and body communication is there. So I have my mentor who adjusts newborn babies right there in the hospital. And of course, all ages. So from newborn to geriatrics, and you have chiropractors that specialize in just seeing pediatric patients. You have others that specialize in seeing geriatric patients. Ones like me that just do sport. You have your general, like some of your chain chiropractic practices that you see here in Houston. But it's more about you on a case-by-case basis. And I'm so glad you brought up the preventative aspect of it, because most of the time, I would say about 99% of the time, people that walk into my office are coming in for a specific complaint. So you're already behind the 8 ball if you're coming in for a complaint. But it can be used as preventative, because pain is the last thing to manifest. The dysfunction is there, and you're able to deal with the dysfunction, and then you get to a point where your body says, I can't, and that's when it sends the pain signal.
Oh, yes.
So if we go before the pain signal comes,
It's
maybe we
too
won't
late.
have as much visits. It won't take as long to heal you. It won't interrupt your life as long. I mean, it's just all positive to be preventative. Definitely.
Awesome. So next question. I'm a new patient.
Okay.
You already talked about the age limit. A lot of times people get scared about going to the chiropractor, right?
Yes.
Because you always think of or see those. They always show the most dramatic things on TV,
Right.
Where you're on the table and you have that jerk of the neck,
Right.
And you hear that cracking,
Right.
Or they're getting an adjustment on their back and they hear that cracking and that scares people,
Right.
Can you just kind of give some information about either what that is or if there are any alternatives, if that's the only thing that's preventing them from seeking chiropractic care?
I can understand it being scary, but chiropractic is really intimate. We're the only doctors that probably touch you. We probably touch you way more than your medical doctor.
Yes.
You know, so and I'm like using my hands the whole time, no gloves or anything, because touch, chiro in Greek, means hands. Chiropractic is to practice with one's hands. So touch is really important for me. So we do palpation, which is just feeling the body and seeing what's going on. But like you said, a lot of people are scared or worried about it, and they do post a lot of videos of like really dramatic things, but you know, that's just for the views. The popping that you hear is not the bones breaking, and that's one of the biggest misconceptions. If we were breaking bones, then we would probably not be doctors. You know, that's going in the wrong way.
The wrong direction.
So the popping sound that you hear is just gas sometimes, or it might actually just be the ligaments being readjusted. It's nothing different from you popping your fingers or popping your own neck. That's what really surprises me. It's like you pop your own neck
all the time.
You pop your own back, and you haven't been to school for this. And I'm saying, let me do it, and I know how to do it. And you're still kind of skeptical of it. But for people that kind of just skeeves them out, maybe they don't pop their own neck and they just don't like that popping sound. We have instruments that we use that could help with the sound. It doesn't sound as bad or as aggressive, but it's nothing dangerous in it at all.
Nothing that should prevent them from going in.
Nothing that should prevent them from going in. My malpractice, which is the insurance that we pay to cover us, is so much lower than a medical doctor because we aren't using drugs in surgery. These people are trained to evaluate how likely it is for me to hurt someone.
So it's real low.
It's very low, very low.
Based on your malpractice insurance, no
issue. It's nothing to be afraid of. And I'm a female, and I walk with my head up because of that. I have a gentle touch, and I hear that all the time. Like, oh my God, I felt just the one that needs to be moved. It's not. You don't hear all of that with me. So yeah.
So next question. off a couple of things that you said. You said that you were a sports chiropractor,
Right.
And I know you are a sports chiropractor, but I didn't necessarily consider you a sports chiropractor,
Right.
Because I go to you and I don't consider myself a
Right.
sports person,
Right.
So you treat other people besides people who play sports.
Yeah.
I just want to make sure that we clarify that.
Right. I can classify myself as a sports chiropractor because I have additional training on top of the general doctor of chiropractic degree. I got a master's in sports health science, which allowed me to look more at biomechanics more than an average chiropractor would, which I thought would give me a competitive advantage once I graduated because I now know what's right and what's wrong. Okay, I can tell you vectors and angles and things like that helps me get you back faster. And that's what the sports part of it is.
Okay.
Has nothing to do with you. It's more about me and
I'm
how
glad.
I assess how I assess the situation. So we're looking at range of motion. We're looking at joint mechanics, something that maybe your general chiropractor is not so focused on. So that's what really makes it sport. A twisted ankle from playing basketball versus a twisted ankle from stepping off the curb wrong. So an athlete versus an everyday person. It's the same twisted ankle.
I just wanted to make sure we get the
looking at it another
way.
way.
Okay,
Yeah.
awesome.
That's all
Awesome.
it is.
So, also my audience, I say we cater towards professionals. We broadcast this at lunchtime.
Okay.
And that's who my audience is. So a lot of them aren't moving as much.
Oh,
I know
man.
sometimes, even though I'm a fitness instructor, I find myself, and I know some other professionals will have the same issue. It's not a good issue to have, and I'm working on it myself.
Right.
I will sit there
Yeah.
all day. I know even as a health coach, I know I'm supposed to set my timer.
Right.
I know I'm supposed to get up and move. I know that sedentary lifestyle is slowly killing me.
Yes.
And it sometimes it gets so bad, even lately, where I'm sitting there so long.
Right.
I have to use the restroom and I'm still sitting there, but because I've been sitting there so long, either at a desk or somewhere else, I have a hard time getting up and getting moving, right? So how can you help those people who are not out doing a lot of movement, who are not out exercising every day, but they're sedentary, they don't have any particular issues,
Right.
but they're causing damage to their body just by sitting all day?
Yeah, definitely getting up and moving is the number one thing. I see a lot of executives at our Greenway location. It's just full of executive offices, so they'll just come down on the elevator to come and see me, and they complain of things such as back pain, shoulder pain, neck pain, even radiating down into the arms. So my biggest thing with them is just incorporating stretches, and it can be simple things. And you want to be like proactive. Don't wait till you get to work to start trying to stretch. Make that one of the first things you do in the morning when your feet hit the ground. Like, I need to do a stretch. I need to touch my toes. I need to reach for the ceiling. I need to turn my head left and right. I need to put my ear to my shoulder. Just really stretching everything, getting warmed up before that, because we're talking about being proactive.
Yes.
So
and
if
then
you
also
wait-
also finding things for people who say that they're busy all the time. So you don't have if you can't make it to the chiropractor, right? There are things that you can do to prevent it from being so bad when you do go.
Right. And that stretching is number one. I'm a busy person running 2 clinics that are 24 hours, and I'm the only doctor. So very busy. I find myself multitasking. So not to be crude, but even in the shower, I'm taking a shower. It's already warm. Why not stretch?
I do a little turn.
Why not stretch there? You know, so just finding ways to multitask. If you're walking the dog, if you have a child that's doing sports, you're sitting in the bleachers doing practice, stand up and stretch. Stand up, take a couple steps. Do a couple calf races. Something. Movement is always beneficial. Always.
So I know we talked about it a little bit earlier about misconceptions. You hit on a couple of them. What are some other ones, or are there any other ones? I just want to make sure that when the audience hears this broadcast, that anything that they can be causing them any doubt about visiting the chiropractor is removed. Because again, we want to make sure that they're starting to be proactive instead of reactive. So you have anything else that
I would say some of the things that I hear is our chiropractors real doctors. And I'm here to tell you we are real doctors licensed by these states. It took me 12 years to graduate. I didn't cop out by becoming a chiropractor. So, yes, we're real doctors. Number 2 would probably be, does it hurt to get your neck popped? And I'm like, no. Does it hurt to pop your fingers? No.
Same thing.
It's the same pop.
So the things that we've already covered
Yeah.
are the basic ones.
Car accident. That's the only time I need to see a chiropractor. Another one that people give me is I'm just old. That irks me when people come in and they're like, I'm just old.
That's the reason why they're not feeling good.
Yeah, and
No.
it's not true. It's not true. You got a lot going on, and you do have wear and tear, but that doesn't mean that your quality of life has to suffer.
Yeah.
So I'm here to tell you, you don't have to live in pain. You don't have to pop a leave every day.
So we're nearing the end of the broadcast. So I wanted to ask you have an event coming up,
I do.
right?
Our Chiro Fusion event.
Yes, February 22nd.
February 22nd is going to be part 1 of a 4-part season for series for 2019. Part 1 is going to be chiropractic and bar and Pilates. We decided to do bar and Pilates for part 1 of the Chiro Fusion because bar and Pilates allows you to build strength but without losing flexibility. And that's something that a lot of people come in complaining about, being inflexible.
I'm one of them.
So February 22nd at our 12 Greenway Plaza location, we will have our part 1 of the Chiro Fusion event. It's going to be an hour and a half long. I wanted to keep it intimate, no more than 20 people. We're going to have Ashley Stevens from Posture Fit. She is the owner of that Pilates bar studio. And she'll be coming in doing a 30-minute class with all the participants. I'm having it catered. We're even supporting other local businesses with sponsored gift bags and such.
Awesome.
So I'm really excited. I hope everybody comes out. I'm really big on education, and this is a time where you can maybe experience something that you haven't experienced before, learn a little bit about chiropractic, and better your quality of life overall.
I like that you're bringing together two different worlds.
Oh,
because,
yeah.
Again, it's a holistic approach.
Holistic, whole body. Chiropractic is not the end all be all. You
Nothing
need other
is.
things.
Yes.
We need it's a portfolio. It's a toolbox of things. So this is the workout that I want to introduce to the community, and we're doing this Chiro Fusion. Our second event is going to be with essential oils. So it's just different ways to live that holistic, healthy lifestyle.
Awesome. I love that.
Me too.
I love
I'm
that
excited.
so much. Me too.
And they can go on Eventbrite, purchase the tickets. They're $30, and they'll be available up to a week before the event, or they can go to our website, healheals.com, and purchase tickets through there.
Awesome. Well, thank you so much. I wanted to say at the end of this, if there's anything that I haven't asked that you'd like to share, just give you an opportunity to do that now. Or if you think we've covered it all, we've covered it all.
I think so.
Awesome.
I think I'm good.
Okay. So at the end of the show, like I mentioned in my intro episodes, my goal is to meet each listener where they are.
Yeah.
We have all kinds of listeners who are listening to us, from the health novices to people who are very enthusiastic about living a holistic, healthy lifestyle. So I want to take each listener from where they are to where they want to be in a manageable way.
Right.
This is not meant to be stressful.
Right.
Or create anxiety. We want to give you small tidbits of information that you can start incorporating into your life on a daily basis. So lastly, I want you to give the audience 3 things, either that they can do at home or to prepare them for their visit with the chiropractor that they can take away with them and start doing as soon as they finish listening with this episode.
I would say number 1 I would recommend is that you compare the right side of your body to your left side. So we talked about pain as one indicator that could bring you into the office, but we are talking about trying to be more preventative. So if we don't have pain to tell us when to come in, what could we use to help us know when to come in? And that would be comparison of left to right. Most injuries do not occur on both sides. It's not going to be both your ankles. It's not going to be both your shoulders. So compare left to right. And when I say compare, if we're not looking at pain, look at mobility and flexibility. So do one motion with one side and another motion with the other side and see how they compare. That can indicate that you would need a chiropractor. The second thing I would really reiterate is sleeping. I have a lot of people that came in. I just had a guy last night that came in with torticollis, which is a crook in the neck, which would be the layman's term, crook in the neck. Medically it's called torticollis, and that's where you can't turn your neck because you slept wrong.
I've done that. That's very painful.
So I would say just making sure that your pillow and your mattress allow your neck and your back to be aligned, which you would need someone else to look at you to see if that alignment does occur. But you can do that. And then the last thing is just make sure you stay active and stay moving every day. All movement is great. Make sure you're stretching. And if you don't have a lot of time, try to multitask. Like I say, I do it in the shower.
Awesome.
All right.
Those are some great tips. I hope that you enjoyed this episode. I want to thank you again, Dr. Hill, for being on with us today.
Thanks for having me, Jamie.
Make sure that you stay connected. Follow us online at the Groovy Beet Podcast. Also, online on Facebook and Instagram at Hill Coach. Subscribe to this podcast on iTunes, Spotify. You can listen on Stitcher. You can listen on almost any podcasting platform, and also on YouTube. Just search the Groovy Beet Podcast. We also want to hear from you, so drop us a line and let us know what you think, any questions you may have, any future ideas for shows or topics you want to hear, let us know. Until next time, be groovy.